Atrioventricular canal defect, endocardial cushion defect. During standard obstetrical sonographic examination, the four-chamber view of the fetal heart is obtained. In this view, the left ventricle and right ventricle, as well as the left atrium and right atrium, are identified. In addition, the mitral valve and the tricuspid valve can be seen. Lastly, the atrial septum primum and ventricular septum can be visualized. During ventricular systole, the mitral valve and tricuspid valve close. During ventricular filling, the mitral valve and tricuspid valve open. The endocardial cushions form the crux of the heart, which sonographically marks the site of atrioventricular and septal planes crossing at right angles. Defects may involve the ventricular septum or the atrial septum primum. Defects of the medial valve leaflets leave only lateral leaflets of the mitral valve and tricuspid valve. Thus, a complete endocardial cushion defect creates a hole in the middle of the heart that is termed an atrioventricular canal or AV canal. Here, both normal and an AV canal defect are shown. Note that the plane of the normal atrioventricular valves resembles an upside-down W. In contrast, the atrioventricular valve plane of an endocardial cushion defect resembles the letter V. These anatomic differences can aid detection of this anomaly. An endocardial cushion defect has characteristic sonographic findings. These include a prominent defect in the ventricular septum and a defect in the atrial septum primum. The septum primum defect results in a common atrium. During ventricular systole, the lateral atrioventricular valve leaflets come together in the midline. During ventricular filling, opening of the mitral and tricuspid valves more clearly demonstrates their absent medial leaflets. This makes the absence of the tissue that would normally form the crux of the heart even more obvious, as highlighted here. This cine clip is from an affected fetus. Movement of the valves and septal defects highlight the AV canal defect. The septum primum defect results in a common atrium. During ventricular systole, the lateral atrioventricular valve leaflets come together in the midline. During ventricular filling, opening of the mitral and tricuspid valves makes the absence of the tissue that would normally form the crux of the heart even more obvious. Endocardial cushion defects occur in approximately 1 in 2,500 births. They are also associated with trisomy 21 in more than half of all cases and may also occur in the setting of heterotaxy syndrome, in which the heart or abdominal organs are on the incorrect side. Thus, evaluation including echocardiography, targeted sonography, and fetal karyotyping should be offered.